Did you know that nearly two-thirds of seniors are unknowingly eating fruits that might be quietly damaging their health? It's shocking, but as a geriatric specialist at the Mayo Clinic, with over 25 years of experience, I've seen this scenario unfold countless times. Patients rush to emergency rooms, baffled and unaware that their seemingly innocent morning fruit bowl is the hidden culprit behind their sudden health crises. Just last month, Martha, a lively 72-year-old from Boston, experienced terrifying heart palpitations. The cause: a common fruit she had been eating every day without a second thought. This story isn't unique. Some fruits, while appearing healthy and harmless, can turn dangerous after age 60, especially if you're managing conditions like diabetes, kidney disease, or heart problems. Today, I'm going to reveal the 6 fruits you should absolutely avoid after 60 and why even a small bite could put your health in serious jeopardy. What you learn in the next few minutes might just save your life. Before we jump in, I'm curious, where are you watching from? Drop your city in the comments below. And don't forget to hit subscribe so you never miss vital health tips designed especially for seniors. Let's start with the most shocking fruit on our list, one that many seniors enjoy without realizing it could be life-threatening. That fruit is dietary, the hidden danger of starfruit. At first glance, starfruit looks like a tropical gem. Its star-shaped slices are beautiful, exotic, and inviting. But don't be fooled by its charm. For seniors, starfruit ranks among the most dangerous fruits you can eat. Why? Starfruit contains a powerful neurotoxin called caramboxin. While younger bodies usually process this toxin without issue, our kidneys lose efficiency with age. According to the CDC, 1 in 3 Americans over 65 suffers from reduced kidney function, many without even knowing it. For these seniors, eating starfruit isn't just risky, it could be fatal. Let me share a real-life story. John, a 72-year-old from Tampa, Florida, was proud of his healthy lifestyle. He added exotic fruits, including starfruit, to his morning smoothies. After a week, he started experiencing severe confusion and dizziness. His family rushed him to the emergency room, where doctors discovered his starfruit consumption had caused dangerous neurotoxic effects, all because of a mild, previously undiagnosed kidney condition. John told me, "I had no idea starfruit could do this." The National Kidney Foundation warns that even small amounts of starfruit can cause symptoms ranging from vomiting and confusion to seizures and coma for seniors with kidney issues. These aren't isolated incidents. I've treated multiple patients with similar stories in just the past year. If you're wondering if you might have kidney problems, ask yourself, do you often feel unusually tired? Do your ankles swell without explanation? These could be warning signs of declining kidney function. Instead of starfruit, I recommend safer alternatives that provide similar nutritional benefits. Asian pears offer a crisp, refreshing taste with zero risk, and dragon fruit delivers the same exotic appeal with powerful antioxidants safely. Both are widely available in grocery stores, often nestled near other tropical fruits. If you're still watching and find this helpful, type SAF in the comments below. And tell me, have you or someone you know ever had a surprising reaction to starfruit? Remember, after 60, your health deserves cautious and informed choices. This isn't about fear, it's about protecting your well-being. Next up, a fruit that might surprise you with its hidden dangers: grapes. Grapes, blood sugar's silent enemy. Grapes are a staple snack for many. Those sweet, juicy clusters often sit in refrigerators across the country, looking like the perfect guilt-free treat. But for seniors, grapes can be unexpectedly hazardous. As a doctor who's worked with thousands of older adults, I must warn you, grapes should never be your everyday fruit after 60. Here's why: a single cup of grapes contains as much sugar as 4 sugar cubes. That's a huge shocker for seniors managing diabetes or pre-diabetes conditions that affect nearly half of Americans over 65. Harvard Medical School research shows that grapes can spike blood sugar faster than almost any other fruit. This sudden surge can lead to dangerous complications, especially for older adults whose bodies struggle to regulate glucose as efficiently as younger people. Let me tell you about Patricia, a 68-year-old patient from Chicago. She thought she was making a healthy swap, replacing afternoon cookies with grapes. But within weeks, her blood sugar became dangerously unstable, affecting her energy, mood, and even her vision. "I had no idea grapes could impact me so strongly," she confessed during a follow-up visit. But blood sugar isn't the only risk. Many seniors don't realize grapes are a serious choking hazard. As we age, our swallowing reflexes slow down naturally. Grapes, with their smooth round shape and slippery skin, are among the top choking hazards for older adults. The National Safety Council reports choking incidents involving grapes in seniors have surged by 30% over the last 5 years. So what's safer, fresh berries or lower in sugar and packed with antioxidants? Melon chunks cut into small pieces offer the same refreshing sweetness with better portion control. Both are widely available, often priced similarly to grapes. If you must enjoy grapes occasionally, here's a simple safety tip: cut each grape into quarters and limit yourself to no more than 6 pieces. Always pair grapes with a protein source like a small piece of cheese to slow sugar absorption and reduce choking risk. If this advice resonates with you, type GA in the comments below. Also, I'd love to hear your favorite grape alternatives. Sharing experiences helps our community stay healthier. Up next, we'll explore another common fruit that could be silently harming your health in ways you might never have imagined: oranges and their connection to acid reflux. Continuing from our last eye-opening discussion about how seemingly healthy fruits like starfruit and grapes can pose serious health risks for seniors, let's now turn our attention to another widely loved fruit, one many believe is a vitamin C powerhouse: oranges. While oranges are celebrated for boosting immunity, there's a darker side that seniors often overlook. As a geriatric specialist, I've seen firsthand how oranges, despite their bright and cheerful appeal, can trigger severe acid reflux, interfere dangerously with essential medications, and even harm dental health. According to the latest data from the GERD Foundation, over 60% of adults above 60 suffer from acid reflux, and citrus fruits, including oranges, are among the leading culprits. Take Margaret's story, for example. At 73, this lively woman from Minnesota was convinced her morning orange juice was helping her stay healthy. Instead, it was causing painful acid reflux that disrupted her nights and gradually chipped away at her quality of life. "I've eaten oranges all my life," she told me, "but now they're causing me so much discomfort." Imagine waking up multiple times a night with burning chest pain or a bitter taste in your throat. This is the harsh reality many seniors face due to acidic fruits like oranges. But the risks don't stop there. Oranges can also reduce the effectiveness of many medications that seniors rely on daily. The Mayo Clinic warns that citrus fruits can interact with over 50 common drugs, such as blood pressure medications, cholesterol-lowering pills, and antidepressants, especially if taken within 2 hours of consuming an orange. This interaction could render these vital medicines less effective, exposing seniors to potentially dangerous health consequences. And what about your smile? Aging naturally weakens tooth enamel, making it more vulnerable to acid erosion. The high acid content in oranges can gradually wear away this protective layer, leading to increased tooth sensitivity, decay, and expensive dental problems. I've seen many seniors shocked to discover that their daily orange habit was slowly harming their teeth without them realizing it. So what's the solution? Fortunately, you don't need to give up vitamin C entirely or rely on oranges to get your daily dose. Bell peppers actually pack more vitamin C than oranges and are much gentler on the stomach. Kiwis are another excellent alternative, easy to enjoy by simply slicing and scooping with a spoon. Both options are usually available year-round in most grocery stores, often in the produce section near leafy greens. Here's a practical tip from my practice. If you absolutely can't resist citrus fruits, try eating them in the middle of the day, at least 2 hours apart from your medications. Always dilute orange juice with water in a 1:1 ratio and never consume citrus on an empty stomach. Better yet, switch to those vitamin C-rich alternatives I mentioned, which won't cause reflux or interfere with your medications. If this information is resonating with you, type ACI in the comments below. I'm also curious, have you ever noticed acid reflux or other issues after eating oranges? Sharing your experiences could help others in our community make smarter, safer choices. Now moving on to a fruit often hailed as a superfood, but that deserves a second look for seniors: the avocado. Let's talk about this creamy green favorite that many consider the golden child of healthy eating. While avocados do offer nutrients, they also come with hidden risks for those over 60, particularly when it comes to weight management, medication interactions, and even allergic reactions. Avocados are incredibly calorie-dense. One medium avocado contains roughly 240 calories, almost as much as a full meal. For many seniors who require fewer calories than younger adults, this can lead to unintended weight gain. Robert, a 75-year-old patient from Denver, experienced this firsthand. After adding daily avocado toast to his breakfast, he gained 12 pounds in just 3 months. "I thought I was making a healthy choice," he admitted, "but the weight gain made my joint pain worse." Even more concerning is how avocados can interfere with certain medications commonly prescribed to seniors. Studies have shown that avocados may affect the absorption of blood thinners, blood pressure drugs, and some antidepressants. Yet many healthcare providers don't warn patients about these interactions. This gap in information could put seniors at risk without them even realizing it. Another surprising fact, avocados contain proteins similar to those found in latex. For about 6% of people over 65 with latex sensitivities, eating avocados can trigger serious allergic reactions. These reactions may worsen with age and sometimes appear suddenly even if the person has safely eaten avocados before. Instead of avocados, I often recommend heart-healthy alternatives like olive oil, which provides beneficial fats but is easier to control in portion size. Small servings of nuts, especially walnuts and almonds, offer similar nutritional benefits without the medication risks. These options are widely available in most grocery stores and often cost less than avocados. If you can't imagine your diet without avocado, here's my safe consumption guide. Limit yourself to no more than half an avocado per day. Always eat it with a meal and monitor your body closely for any unusual symptoms. Most importantly, consult your healthcare provider about potential medication interactions. If you found this advice useful, please type healthy in the comments. Have you noticed changes in how your body responds to avocados as you've gotten older? Your stories might be exactly what someone else needs to hear. Finally, let's discuss a fruit many seniors crave on hot summer days, but that can quietly disrupt health in unexpected ways. Watermelon. While it seems like the perfect, refreshing treat, especially during warm months, seniors with heart or kidney issues need to be cautious. Recent research from the Cleveland Clinic reveals critical insights that we'll explore next. Picking up where we left off after exploring the hidden dangers of avocados, let's dive into another seemingly harmless fruit that can actually pose serious health risks for seniors: watermelon. At first glance, watermelon looks like the perfect summer snack, refreshing, juicy, and hydrating. But for many seniors, especially those managing heart conditions or on diuretic medications, watermelon's high water content can seriously disrupt the delicate fluid balance in their bodies. Imagine your body as a finely tuned machine. Too much fluid in the wrong place can throw it off completely. Take Betty, my 78-year-old patient from Arizona, as an example. She believed she was making a smart choice by eating watermelon to stay hydrated during the scorching summer months. However, within just a few days, Betty experienced dangerous fluid retention. Her ankles swelled and she struggled to breathe easily. This sudden onset of symptoms landed her in the emergency room. A simple fruit had triggered a serious medical emergency. But it's not just the water content you need to watch out for. Watermelon's natural sugars can be misleading. While it might seem lighter and healthier than other fruits, watermelon has a surprisingly high glycemic index. For seniors with diabetes or pre-diabetes, even a moderate portion can cause significant spikes in blood sugar. According to the American Diabetes Association, eating just 2 cups of watermelon can raise blood sugar levels as much as drinking a can of soda. That's a sobering thought for anyone trying to manage their glucose carefully. Now add to this the fact that kidney function naturally declines with age. Nearly 40% of adults over 65 have reduced kidney function, making it harder for their bodies to regulate potassium levels effectively. Watermelon is high in potassium, and too much potassium can lead to dangerous heart rhythm problems, a risk many don't realize can be tied back to their fruit consumption. So what's a safer way to stay cool and hydrated during those hot summer days? Let me suggest some gentle yet refreshing alternatives. How about cucumber slices infused in water? They deliver that cool, crisp refreshment without the sugar spike. Or try frozen berry chunks, which provide a similar cooling effect, but with better blood sugar control. These options are widely available at your local grocery store, usually right in the produce section, and they won't throw your system off balance. If watermelon is your absolute favorite and you simply can't give it up, here's my safety protocol. Limit yourself to no more than half a cup at a time. Always eat it alongside a source of protein, which helps slow down sugar absorption. Avoid watermelon after 6 p.m. when your body is more prone to fluid retention. And pay close attention to any swelling in your ankles or unusual shortness of breath signs that your body might be struggling. If you're still watching and find this helpful, type summer in the comments below. I'd love to hear your experiences with watermelon or other summer fruit alternatives. What keeps you feeling refreshed without compromising your health? Let's move on to our final fruit, a tropical favorite many seniors rely on for digestive health, but one that comes with surprising risks: papayas. Papayas are often praised for aiding digestion, but seniors need to be very cautious. What many don't realize is that papaya contains an active enzyme called papain, which can dangerously interact with common medications. The FDA has recently issued a special warning about these enzyme interactions, especially concerning blood thinners, diabetes medications, and some antibiotics. These aren't minor issues. Papain can significantly alter how your medications work, sometimes reducing their effectiveness. Helen, my 71-year-old patient from San Diego, experienced this firsthand. After she started eating papaya daily to help her digestion, her blood pressure medications suddenly stopped working as expected. This unexpected change led to uncontrolled blood pressure and serious health concerns. Even more alarming is the connection between papayas and latex allergies. About 35% of seniors with latex sensitivities also react to papaya. These allergic reactions can become more severe with age and may show up suddenly even if you've eaten papaya safely for years. Symptoms range from mild itching to dangerous breathing difficulties, which is especially risky for older adults who may already face respiratory challenges. The Journal of Geriatric Medicine recently published a study showing that while papaya's enzymes might aid digestion in younger adults, they can irritate the more sensitive digestive systems of seniors. Many of my patients report unexpected bloating, acid reflux, and stomach discomfort after eating papaya, particularly on an empty stomach. So what's the safer route? Probiotic-rich foods like plain yogurt or fermented vegetables provide similar digestive benefits without these risks. Ginger tea is another gentle, stomach-friendly option, widely available and easy to prepare at home. These alternatives support digestion and keep your system calm and balanced. If you absolutely must eat papaya, here's my safety guide: never consume it on an empty stomach. Always consult your pharmacist about possible medication interactions, and start with only 2 to 3 small pieces to test your tolerance. Most importantly, stop immediately if you notice any unusual symptoms. If you're finding this information useful, type digest in the comments below. I'm curious what safe digestive aids have worked well for you. Sharing your experiences could really help others in our community make wiser choices. Remember, being informed about these risks doesn't mean you have to give up fruit altogether. It's about making smarter, safer choices to protect your health as you age. Stay tuned for my upcoming video where I'll reveal the safest fruits for seniors, those that offer excellent nutrition without the hidden dangers we've talked about today. As we wrap up this essential discussion, keep in mind these 6 fruits: starfruit, grapes, oranges, avocados, watermelon, and papayas can pose serious health risks for seniors over 60. They may seem healthy, but they can silently undermine your medication effectiveness, blood sugar balance, and overall well-being. Don't let this overwhelm you. There are plenty of safe, delicious alternatives. Always check with your healthcare provider about your unique situation, especially if you take medications. Your health is too precious to take unnecessary risks. So which fruit from today's list surprised you the most? Share your thoughts in the comments below. And don't forget to subscribe for more essential health tips that can help you and your loved ones live a healthier, safer life. Your future self will thank you for making these informed choices today.